Good day, class. From this video, we are going to talk about the wind heat releasing herb. Due to the different natures of the bacteria releasing herbs, these herbs are divided into two categories, wind heat and wind cold dispersing. In the previous videos, we have introduced some of the wind cold dispersing herbs. They can be used in a wind cold syndrome. And from this video, we're going to talk about the wind heat dispersing herbs. The common characteristics of this group of herbs: they are pungent, they are cool, or even cold. Cool or cold can dispel the heat. Pungent can dispel the wind. So they can be used to dispel the wind heat, can be used in an bacterial wind heat syndrome. Patient may present with aversion to wind or slightly aversion to cold. The patient may present with fever, thirst, body pain, sore throat, red tongue, especially the tip, thin yellow coating, a floating and slippery pulse because of the wind. The wind is a young pathogen. Young pathogen has the characteristics to moving outwards. So this group of symptoms in the wind heat syndrome, the patient may present with the discomfort or the diseases in the upper part of the body. For example, headache, sore eyes, red eyes, sore throat. So in these upper parts of the body, because of the heat also moving outwards, the wind also can move outwards. So more commonly, the patient will present with symptoms in the upper part of the body. The first herb, 薄荷. 薄荷 is mint, so the same as the mint we use here. Pungent and fragrant, cool. Pungent can dispel the wind heat in the lung meridian. Fragrant and cool can activate, especially fragrant can activate, and pungent also can activate the liver stagnation. So 薄荷 or mint can be used in a wind heat syndrome. It also can be used in the liver stagnation. Also from here, you will see that 薄荷 mainly the lung and the liver meridian. In a wind heat syndrome, 薄荷 can dispel the wind, dispel the heat, so it can be used in this syndrome, especially in the situation that the patient doesn't have sweat. So a patient have no sweat, or only a mild sweating, then we can use 薄荷. 薄荷 also fragrant. The smell, fragrance is also the leaves. It can move outwards, so it can be used for headache, especially for the headache due to wind heat. Because 薄荷 can dispel the wind, so it also can be used for the wind in the skin, for itching skin. This herb can be used to activate the liver stagnation. So the liver stagnation, a patient may present with distending feeling in the abdomen or the abdominal pain, the discomfort on both sides of the abdomen. So these are the typical symptoms of liver stagnation. Also in ladies, they can feel discomfort in the breast. So in this situation, we can use 薄荷 to relieve the liver qi stagnation. However, I have to say that the Bohe, the function of activating liver stagnation is not very strong, so it's a mild function. In this patient suffer from the liver stagnation, we're going to use Bohe with the other herbs. So when you use only the mint, it's not enough. It must be used in a prescription, in a formula with the other herbs. Because Bohe can disperse the wind and also may result in sweating and disperse the qi. So a patient suffer from all kinds of symptoms, but accompanied with the sweating. In this situation, we need to be careful when we use Bohe. We need to avoid excess sweating, which may result in yang deficiency. So that's the lung meridian. Something in the upper part of the body, because of light, can dispel wind, stop itching. Something in the upper part of the body can be used for liver stagnation, but this is not dominant. Niu Bangzi. Niu Bangzi is another herb, pungent and cold. It also can be used in the wind cold syndrome, and especially patients suffer from wind heat syndrome, especially with the sore throats, because this herb is good to relieve the sore throat. It also can reduce the mucus. So it can be used for patients suffer from coughing due to wind heat and with phlegm. So in this situation, the patient may be coughing, but the tongue, especially the coating, will be yellow. The tongue must be red. As you can see, all these herbs, the one we have introduced, no matter from wind cold releasing herbs or wind heat releasing herbs, they all similar. In the same group, they all similar, but they have their specialities. They got something they are good at. There's something you need to remember. If a patient suffer from headache, runny nose, and sore throat, then you can think about Niu Bangzi. A patient suffer from headache and runny nose and edema, then you can think about the previous herbs that we have introduced in the wind cold dispersing herbs, such as the xiangru. So that's how we use. You need to remember the common characteristics as well as the typical characteristics of specific herbs. This will be very similar to when we study acupuncture. The acupoints, when we study acupoints, you also need to remember the common characteristics, the common actions of this group of acupoints. And then you also need to remember the specific action of individuals. That's how to choose when you practice